when you have a diagnosis, the treatment is the gluten-free diet. And it's not just a, laissez-faire approach to a gluten-free diet. It's like very serious, very strict for life. There's no wiggle room here. The asterisk to that is if we do get meds down the line, they are in clinical trial in adults right now. There is the potential that we will see that in the next decade or so. Hopefully, I think there's multiple drugs in trial right now from what we learned from our pediatrician. So I think that's really exciting. And so there's that piece there. But in the meantime, and especially while you're waiting for that and while you're actively trying to conceive, we need that gluten-free diet. And there was a research paper that actually looked at women who were diagnosed and then went gluten-free. And for the women who were struggling with fertility issues, there was 12% of them before the gluten-free diet, and there was only 3% of them after. So it's a 4 times whatever decrease, right? That's pretty good. So there's obviously still some women struggling, and that's because it's very likely that it wasn't just celiac disease. But that's a pretty big decrease just from gluten-free diet, just from removal, because that is the only treatment. There's no other way to treat it. There's no way around it. Once you take gluten out, the immune system stops creating that transglutaminase antibody. As that antibody decreases in your system, the villi in your small intestine grow back. When they do that, they can now absorb your nutrients. So it's very common to be iron deficient, zinc deficient, magnesium deficient, selenium deficient, B vitamin deficient, vitamin D deficient when you can't absorb your nutrients in your small intestine. And we know that nutrient deficiencies have another trickle down effect in terms of how your other hormones are working and how your enzymes are working and egg quality and sperm quality and all of those things. So we need to get that villi back in action so that you can absorb your nutrients. But also it's that reduction in the immune system that has an effect on the fertility potential. Because if your immune system is overactive, you've heard me say this if you've listened to other autoimmune podcasts from me, if your immune system is overactive, of course it's going to have a negative effect on an embryo that is only half your genetic material, right? It's already attacking your own body. The second it sees something that's not fully yours, of course it's going to struggle with that, right? We want to get that immune system rebalanced and reestablished. And we want to do that as quickly as possible.